Welcome to managingmyeloma.com. My name is Dr. Bob Orlowski. I'm the director of the myeloma section and the acting head of the Department of Lymphoma Myeloma at the University of Texas MD Anderson Cancer Center here in warm Houston, Texas. One of the questions that I'm frequently asked is, should we still be using the international staging system to stage patients with myeloma, or should we be using the new revised ISS staging system? First of all, the difference is that the ISS uses beta-2 microglobulin and albumin as the only factors, whereas the revised version uses additional factors including things like the level of the lactate dehydrogenase and the presence or absence of standard or high-risk chromosome abnormalities. The International Myeloma Working Group has prepared a manuscript which should soon be appearing in the Journal of Clinical Oncology, which will provide additional detail. But the benefit of the system is we know that even patients who have ISS stage 1, who under normal circumstances should be doing quite well, if they have a poor risk cytogenetic abnormality, their outcome is actually not the same as people who have ISS stage 1 with no high-risk cytogenetic abnormalities. In the data that were put together by the International Myeloma Working Group, if you just use the classical ISS system, more than a quarter of people will have an incorrect prognosis predicted because you're not incorporating things like cytogenetics and LDH level. So the new system is definitely more accurate, and ultimately what, of course, we all want to do is try to give our patients the best indication of their outcome, in part because moving forward, we're going to be treating patients differently based on whether they have stage 1, stage 2, or stage 3 disease. So do look for the revised ISS staging system when it's published in the Journal of Clinical Oncology, and do use that when you're staging your patients. I hope that this has been of help to you, and thanks very much for tuning in.